I think we'll get started while people are filtering in. So welcome to our 5th webinar in our technical webinar series on climate change and health. Today we'll have the opportunity to delve a little bit deeper into the process of conducting a climate change and health vulnerability and adaptation assessment. So we'll be looking at GIS and risk mapping and spatial analysis for climate change and health vulnerability and adaptation assessments. Just a little bit of housekeeping as always before we get started. So the same as all the other webinars, we have 2 sessions, one this morning and then one in the afternoon. The content will be the same, so there's no need to attend both sessions. The webinars are recorded and we will put them on the WHO website following the webinar. Here's the webinar schedule. So the next one will be in July, looking at climate resilient and environmentally sustainable healthcare facilities. As always, if there's any topics that you would really like to cover and aren't listed here, please do send us an email and we're happy to look into that. We do have simultaneous interpretation today. So this morning we have English, French, and Arabic. So just have a quick look at the instructions here, set up your interpretation if you need it. And there are quite a lot of people here in the meeting today. We've set it up as a meeting rather than a webinar so that we can encourage a little bit more engagement and discussion. And we have an open Q&A session at the end of the webinar. But please do remember to stay muted when you're not speaking. And feel free to use the chat and the Q&A. We'll endeavour to answer your questions throughout the webinar, otherwise in the live Q&A, or we'll follow up as needed. So this is our agenda for today. In a moment, I'll hand over to Dr. Diarmid Campbell-Lendrum, who is the head of the Climate Change and Health Unit, and he'll provide an opening and setting the scene for our agenda for our webinar today. Following that, we will have a presentation by Dr. James Chirombo, who is a biostatistician at the Malawi Liverpool Wellcome program. So he'll be giving us an introduction to some of the key concepts and ideas around GIS and spatial analysis. Then we'll hear from Samuel Omara, who works at WHO in the GIS Centre for Health. And after that, we'll hear from David Ogier for talking about the experience of conducting a climate change and health vulnerability and adaptation assessment in Nigeria and using spatial analysis in that assessment. And finally, as mentioned, we'll have an opportunity for discussion and Q&A. So with that, I'll hand over to Dr. Diarmid Campbell-Lendrum for the first presentation. Thank you.
Thanks so much. Can I just first check that you can hear me?
We can hear you.
Brilliant. Okay, and I'm just in the usual process. Everybody knows this by now. I'm trying to share my screen so that we can start the presentation. Can I check that you're also seeing the right screen?
We can see it. It's not in presentation mode yet.
Okay, right. We'll go through the usual steps. Hopefully presentation mode will come up.
Yes, now.
We're there. Brilliant. Okay, well, thanks very much to everybody for joining. Apologies for the slightly late start. We adapt very easily, but we're just overcoming the usual technical hitches as we start off these things. And once again, a big welcome to this really important series that, as you've seen from the overall program, it's part of a comprehensive program of technical support to support countries and partners to raise the standards and also to share experiences around the various different disciplines that can help to achieve better and more comprehensive programs on climate change and health. So this webinar is quite a specific one. It's about a specific technical approach that supports the process of carrying out health vulnerability and adaptation assessments for climate change and health. And the remarks I'll be making will be quite brief. I'm aiming to get done within 15 minutes or hopefully slightly less. And they're just aiming to provide a broad introduction making the connection between material that we've covered previously in the seminar series about the overall process of carrying out a vulnerability and adaptation assessment in order to understand the health risks from climate change and what we can do about them, and connecting that to the specific technique of using geographical information systems, using GIS in order to support those assessments, in order to get a better understanding of our issues and a better targeting of the responses that we want to put in place. And here I should just pay credit to Carlos Corvalan, who has worked on climate change and health for many years, and among many other things, has put together the few slides that I'll be presenting today to kick the meeting off. First off, just to make clear that although GIS may sound like a very modern technique to apply to public health, in fact, the idea of geographical information applied to health goes back to the origins of public health itself. This is a quote that we've been using for many years from Hippocrates, the father of at least Western medicine. And if you read that quote, you can see that there was already that understanding that in order to understand any health issue, it helps to understand the geographical determinants of those health issues, and in relation to climate change, the climatic determinants of those issues as well. So the idea has been there for forever, if you like, for as long as we've had the idea of medicine. It's also been there for as long as we've had the idea of public health. Many of you who will have had public health training will know about the famous example of John Snow's investigation of the origins of cholera, which in many ways was a GIS study. So an understanding of where cholera cases were occurring made it possible to understand where the problem was originating from, and therefore allowed a targeted intervention in order to remove the source of the problem. And that was already effectively a GIS study, but you can also apply modern GIS mapping techniques to that historical example. So hopefully it's clear that this concept is one that's been around for a long time in public health. And here to make the connection to what we are trying to do in improving the public health response to climate change. Hopefully you will be aware that we at WHO have been working with countries to support vulnerability and adaptation assessments for many years now. And that forms the basis of the understanding of what the main health challenges are, where they're occurring, and therefore where we should deploy responses. So the guidance that we have published and then updated recently documents a series of steps, and I just wanted to highlight amongst those steps which are the ones where GIS is most relevant. You'll see that the main point at which we think this is relevant is in the vulnerability assessment stage, where we can use geographic information systems to identify trends in the drivers of climate-sensitive health outcomes. We can use it to identify vulnerable populations in geographical regions, and we can also use it to document baseline information for then assessing changes in future vulnerability and also evaluating and targeting adaptation options. So that is basically the core. That's the center of where we think GIS is most relevant within this overall process that we've been describing for some time, and is central in this webinar series. You'll notice a slightly unusual numbering. We discussed step number 2 first because it's the most important, but in fact GIS is relevant in other stages of the process as well, in terms of getting started, in terms of assessing the capacity to respond, and assessing the projecting forward future risk as well. So what I'll do very quickly is just to run through a few examples of where we have already seen GIS being applied to the different stages of the assessment, and that is an introduction then to the other presentations that you will hear, basically giving more information on how GIS can be used in order to both increase the coverage of how much we use GIS and increase the standard and applicability of how we use GIS in vulnerability and adaptation assessments. So I'll go through these very quickly, but just basically to show the diversity of examples. But in many of the countries with which we've been working for the longest through our climate change and adaptation projects, it is quite routine for them to use GIS, even to start to kick off the work, even to kick off the first stages of the V&A, including identifying study areas in which to start examining the links between weather and climate variables and health outcomes. So we have examples from Bhutan, where they had already decided that the issues of diarrheal disease, malaria, and extreme weather events were the main challenges that they wanted to investigate and respond to, and GIS was used to identify the study sites in order to investigate those relationships in more detail in order to start planning the response. We see it in Uganda, where again, where there was already some understanding of what the country thought were the main challenges that climate change was likely to bring, then it was possible to identify the districts in which the study could be started in order to investigate those relationships in more detail. Again, another example, in this case, the selections were made not just on the basis of what were the health issues, but also in order to get some geographical representation of the different parts of the country, in order to look at the different relationships and the different challenges that were faced in different parts of the country. So this is something that we see quite often, that GIS will be used to identify climatic zones or agroecological zones. And in your own countries, there's often a very clear understanding of the different parts of the country which may be higher, maybe higher altitude or low altitude, drier, wetter, or have different kinds of vegetation types. And GIS can help us to understand that variation so that when we start studies, we're able to get representation of the different zones in order to get that differentiation of the relationships between weather, climate variables, other determinants in health outcomes. And just in the interest of time, I'll skip over this one, but it's basically capturing the same idea. Moving on from that first initial step to look at the actual vulnerability assessment itself, we also have multiple examples of where countries have used GIS in order to map the spatial distribution of the weather and climate hazards that they may want to investigate. So they're can be used, for example, to map where it's hotter or where temperature is more variable. And both of those properties are important for vulnerability to heat stress, where rainfall is higher and also more variable, and where factors like relative humidity basically show those same properties. So this is a slightly different thing where we're actually looking at the geographic variation in the hazard, as well as using in addition to using it to identify where we should investigate. We also use it for identifying not only the vulnerability to the climatic hazard, but we can start to overlay that with information on the other aspects of vulnerability as well. So here are examples from Guinea, where we're looking for temperature and precipitation, but also combining that with information that we may have on the overall vulnerability of the health of the population or of the health system, but also where we already have, for example, high rates of some of the diseases or other health outcomes that we're interested And moving forward in terms of the sort of the sophistication of combining information, this is an example from Ethiopia, where the country, based on previous analysis, had decided, had formed a judgment over the factors that combined to form overall vulnerability to the health impacts of climate change. So they were combining information on exposure to climate risks, the sensitivity of health outcomes to those risks, and also the measures they have of adaptive capacity to calculate an overall index to say, well, these parts of the country should be prioritized for further investigation and for the deployment of adaptation measures. So hopefully you can see a sequence of combinations of different kinds of information in order, in this case, to get an overall vulnerability impact. I think, again, just in the interest of time, I'll skip over this example, but it's basically another country using that same idea of combining information in order to prioritize different zones that have greater or lesser overall vulnerability to climate change. Moving on to a slightly different property, GIS can also be used within those stages of the vulnerability and adaptation assessment to assess where not only the risk from the climate variable is high, but also where the vulnerability and the adaptation, the vulnerability may be high and the adaptive capacity may be low. So we can say that, leaving aside for a moment the climate information, we may want to look at where we have challenges in terms of, for example, poor conditions for the underlying social determinants of health and weaknesses within the health system. So this is an example from Nepal, where they mapped the indicators of human capacity, things like educational resources, availability of financial resources, availability of health facilities and institutions, and so on, in order to determine, what those underlying causes of vulnerability to climate risks may be and how they were distributed in the country. And the final example, the final stage which we wanted to highlight, was, in addition to understanding the current risk of climate variability and change overlaid on the underlying determinants of vulnerability in terms of social systems, public health systems, and so on, we can also use GIS in order to project the spatial distribution of the evolution of future hazard. So this is an example from Mauritania, where forward projections of different climate scenarios were used to highlight where in the country we may see a greater increase in this case the number of very hot days out for decades out into the future. So this is basically the final stage at which we can use GIS to understand the evolution of, or the projected evolution of future risks as well. So in order just to quickly sum up that introduction, GIS and mapping in vulnerability and adaptation assessments not only can be used, but are already being used in order to identify study areas, to map the current distribution of hazards, exposures, and vulnerabilities, to potentially to look at data analysis, for example, as the basis for data analysis, for example, to look at geographical correlations between weather and climate variables and health outcomes, to understand trends, both observed trends in the past, but also to forecast future risks, and therefore, on the basis of all of that, to display complex information in a visual form, which we know from many examples are quite engaging for policymakers, for decision makers, and even the general public in understanding where and how risks are evolving, and use all of that as a support for decision making. Now, to make the handover from this basic introduction to the next presentation, we see up until now, GIS information has mainly been used for displaying base information that we have, and we have fewer examples of where it is being used for geographic analysis in order to form the basis, for example, of future projections. The way in which it's been used up until now, it's been really good. We're really encouraged by the use of GIS almost routinely now within V&As. But one of the reasons for holding this webinar is to raise the bar, if you like, is to look at the other ways in which GIS can be used in potentially more sophisticated forms in order to get a better understanding and a better use of geographic and climate information in order to target interventions. So with that, I'll once again thank Carlos Corvalan for providing the information that has been used in this presentation. Hand back, I guess, to Amy as the moderator in order to make the transition to the next presentation. Thanks again.
Thanks so much, Diarmid. Really useful to set the scene and see where spatial analysis can fit within the V&A process. Now to delve a little bit more into the content of what is GIS, how to use the tools, and how to use spatial analysis in a V&A. I'm really pleased to hand over to Dr. James Chirombo. James? Your audio is cutting out a little bit.
Okay, can you hear me now?
Yes, that's better.
Okay, all right. Let me share my screen. Yeah, let me try to enable my camera for. Maybe it won't work. Okay, I'll just go ahead. All right. So I'm going to, can you confirm that you can hear me perfectly fine?
We can hear you and we can see your slides.
Okay, all right, thank you. I'm going to take you through a few slides. I'm just going to give a high-level introduction to GIS and a few ideas on risk mapping in V&As. I'm going to assume that not everyone knows GIS, so there might be some very basic information, so just bear with me. So I hope by the end of these few slides, you'll be able to understand some of the terminologies that are associated with spatial data and GIS mapping, but also become more aware of some of the data sources that you can use, especially how and where to find spatial data for your use, and a brief overview of mapping using quantum GIS. So to begin with, when we talk about spatial data, we're simply referring to data that is associated with a geographical location. And every day we do work with data, but if our data somehow is associated with a geographical region or location, then we are talking about spatial data. These locations could be coordinates such as latitude and longitude. And when we everything together, when we talk about GIS, it's just a computer system which is designed to handle this spatial data. It does a lot of things, allows us to visualize the spatial data, do some data management with the spatial data, with creating spatial data files, merging data, transferring data from one source to another, for example, spreadsheet into the GIS. So a GIS program allows us to do all these complex stats with spatial data, allows us to do the data analysis itself by using spatial data. So there are so many GIS softwares around. It's Quantum GIS, which I'm going to talk about, but there is ArcGIS. ArcGIS is a commercial software, but Quantum GIS is a free software. It's free available for use, and you can simply download and you'll be good to go. So it's quite a powerful software. It has got base functions, but also it allows you to extend this functionality by downloading and installing plugins to extend these capabilities. So it's a very comprehensive GIS application. Now, going back to the spatial data, mostly we talk about two types of spatial data, and this is how data are represented. We have what is known as vector data and raster data. So these are the two types of spatial data. For vector data, we use spatial vector data rather to display features like points, lines, and polygons. So vector data allows us to represent features that are associated, that can be represented as lines or polygons or points. For example, household locations. So on a map, can represent household locations by just a set of points, or administrative boundaries. So they will be represented as a polygon, just a boundary, maybe national boundary or sub-national boundaries, administrative boundaries, or features like rivers can be represented by a line, and so on, or road network, and so on and so forth. Or location of weather stations, for example. So you can use points, lines, or polygons to display and represent geographical features such as rivers and so on. So that's the first type of spatial data that we encounter. And when we are working with this vector data, is commonly stored in a format known as a shapefile. Just a note here that a shapefile is a set of validated files. So when you talk about a single shapefile, it's not just a single file. There are at least 3 files that are required to complete the set of files. So recently, there are newer formats for vector data like GeoPackage or GeoJSON, but shapefile is still common, and you are likely to come across shapefiles rather than a GeoPackage. But these other packages or other formats are gaining prominence as well. So just to emphasize the fact that shapefiles are a single shapefile is made up of multiple files, related files. So when you want to use shapefiles, you have to look for the one that has got an extension .shp. That will store the geometry, whether it's a polygon or a line, it will be stored within that file with an extension .shp. There are other files that are associated like .shx, which keeps the index position. The dbf gives a table of attributes associated with the geometry. We'll get another file known as the projection extension file. So the main message here is that shapefiles are made up of multiple files. So a single feature will not come just as a single file. We'll have at least 3 files associated with it. The next one is raster data. This is the second format of spatial data. Raster data, also known as grid data. So the main difference with the vector data is that raster data are used to display data that are continuous across space, as opposed to the vector data, which you can use to represent features like a household, a hospital. Those are just points, so it's not continuous. But with raster data, rather, you use it to represent information that is continuous across space. I can think of an example such as maybe elevation. Okay? So in any geographical setting, if you look at elevation, it changes continuously. So you can't represent the elevation of an area by a set of points or lines. So you have to have some kind of a continuous surface to represent the continuously changing feature behind. So to achieve that, you use a matrix of pixels or cells. So each cell then contains a value that represents a condition that that cell covers. Well, maybe if I go to this next slide, can shed more light. So this is a basic representation of raster data. So I've got your matrix of cells. So the green dot there will represent a particular point on the Earth's surface, and it will have with it associated, it will be associated with a particular value that it represents on the ground. So you can see how this square divided into pixels then will potentially cover the entire space. So here we've just shown one single pixel, but all these squares will have a particular value, and we can show it by different color to show that it has got a different value. Whether it's, for example, elevation, a certain square will have maybe pink color, for example, to represent a higher value, and so on. So we end up having a figure which varies continuously over time, over space rather. And still on the raster data, to obtain it, you can use two ways. These are the primary ways of collecting or obtaining raster data. You can use satellite imagery or aerial photography. So for satellite imagery, we have got satellites orbiting the Earth at very high altitude. And as they are orbiting the Earth, they are taking pictures of the Earth's surface. So you can have some satellites that are taking pictures or images of the vegetation cover, the elevation, whether there's an event of a flooding, you can have aerial photography or satellite imagery taking pictures of the extent of the flooding. So those kind of images, they will cover the entire Earth surface. And you can also have aerial photography. This can be used, for example, maybe using drones where you have a camera, a high resolution camera attached to your drone, and you are flying it over a particular area, and you are taking measurements of the ground underneath according to what you want to capture. So the entire process of taking these images, whether by satellite or aerial photography, is known as remote sensing. And just to mention here that the size of the cells in the previous slide where I showed a matrix of cells, so the size of the cells or the pixels determines the spatial resolution and determines how clearly you are able to represent or to show the features on the ground. So that is given by the spatial resolution. Okay, this is just an example of how a raster data would look like. This is an example of elevation. So you can see, just to emphasize the point that there is a continuous variation. That's the hallmark of raster data. So you can see within each, if you move from, let's say, left to right over this image, you will see variation by looking at the legend. The colors will represent the magnitude or the altitude in this case, but it can be anything. So that's how raster data would look like if you display it in a GIS application. I think another important idea to introduce is that of global positioning system, or GPS. So how do you assign, when you have data, how do you assign geographical coordinates to your own data? So you can have, for example, the example of the satellite imagery that we have just talked about. The data will cover the entire surface of the Earth. But if you're interested in data for a particular region, then you have to assign geographical coordinates basically you're kind of extracting data from the raster data to match your geographical region of interest. So that's where it's important to have geo coordinates or GPS coordinates to identify your area of interest. So we usually collect this, you can collect it during data collection. If it's in a survey, I think these days more and more people are collecting geo coordinates together with the other data that they collect during surveys and so on. So you can use GPS receivers to record locations, whether households, communities, and so on. You can also just assign coordinates to your data using features like Google Maps. There are so many possibilities. But the point here is being that when you have the data, it has to be referenced to your exact location of interest. All right. So there are so many sources of spatial data around. These are just some examples that I could think about. The first one is humanitarian data exchange. This is a free repository. People just share data online. If you collect data and you want to share it with the wide community, you can just deposit there. Others could get access to your data. So it's a very powerful tool. You can take a look at it. It will have information on disease outcomes, geographical boundaries, and so on. So many data sources, data types in the humanitarian data exchange repository. For administrative boundaries, this is very important for mapping. The first presentation that we saw a few slides with geographical boundaries, administrative boundaries. So you can imagine as individuals, it's almost impossible for us as an individual or as an institute where we work to collect our own geographical boundaries, because we have to rely on official boundaries. So one repository that we can use is the gadm.org. This is a very powerful website. It almost works like a Google search. You can just type the name of your country of interest, and you get the boundaries. And the boundaries are categorized by levels. You can have national boundaries. In the case of Malawi, where I'm from, you can have district boundaries. Other jurisdictions, you can have counties and so on. So all the different levels of administrative units you can get from this website, and it's free. For climate data, there are so many as well, WordCrim being another example. And typically here you can obtain raster files for past climate. And sometimes, as we saw in the first presentation, you might be interested in building a database that combines climate data, disease data, and some social demographic, socioeconomic data. So in general, this website, WorldPop, also provides a lot of important data sets that you can use to perform V&As to beef up the data if you want to consider some socioeconomic population and so on. So these are some of the more common sources of data, but they are by no means exhaustive. There are so many sources out there. Now, going a step further, just in the next few slides, I'll just talk a bit about some examples that come from Malawi, some of the work that we have done in the past for mapping. But before I get there, I think maybe just to point out some of the things that we might need to perform mapping and risk mapping in general. If we are talking about diseases, then we obviously need to have data on disease incidence or prevalence. And the DRS, since we are talking about climate change issues here, if we can have time series of data that spans a lot of years, that would be ideal. We might need to have some covariate data, whether it's climatic data, socioeconomic data, as I mentioned, or other supporting data that we think has got an impact on the disease outcomes. So we want to use all that to have a better understanding of what's going on with our disease outcomes. And as mentioned, if we want to do the risk mapping to end up with a GIS application, then we need to have a spatial data at the required scale. So if I want to do mapping at district level, I need to have data at district level. I can go to a sub-district level if I want to, by looking at the data at the required administrative. So that's the issue for spatial scale. You need to have the data at the desired spatial scale. Yeah, so once you have the data, the geographical data, the disease data, then you might have to build a database that you can use going forward. And that can be done by integrating the climate and then climatic data into a single data set. Typically, to begin with, you want to do some basic statistics just to see whether there are some associations between your disease outcomes and some of the geographical, environmental, climatic variables, and so on. So beyond the descriptive statistics, it might be important, it might be necessary to do some statistical modeling, fit some models to estimate the outcomes. And this will primarily be driven by the data type. So for example, if maybe the data that I have are disease counts, maybe number of disease cases at a district level across my country, then I'll end up with count data, and that will determine the kind of models that I can fit to the data. Maybe I can think of a Poisson regression or negative binomial. You can have binary data in some cases, or proportion data. Then you can also think of the right kind of model to represent this data. But the goal really is to estimate, but also to predict. So if you go back to the area example that I gave about, let's say, point data, let's say you have data from a survey, you just sampled households, but you might be interested in having a more comprehensive idea of the risk across the entire country, not necessarily just a few locations. So it means you have to do some kind of prediction. Basically, the values that you have obtained at a point, can you then extrapolate that to an area that was not sampled? So in the end, you want to have some kind of a continuous estimate to be able to predict hotspots. So I'm going to show an example for that, the last point towards the very end of this presentation. Okay, so we're going to look at two quick examples for malaria and cholera in Malawi and what we did. So just some background information about the cholera. So in Malawi, we recently had cholera outbreaks, and it was so unusual in the sense that almost for 2 years, it was continuous. In the past, we used to have, or you could have cholera outbreak, maybe rainy season, then it disappears. But this one, it almost ran continuously through the rainy season, the dry season, then another rainy season. So it was quite an unusual outbreak. So you can use the GIS to just have an idea of how the cases were distributed across the district. So in Malawi, I'm going to give an example of district level heterogeneity in the cholera cases. So for example, this is how the data looks like. So you can have, you have got date, district, number of cases, and number of deaths recorded. Then the question then is, how can you think, maybe this is a common representation of data that we get from public health institutes. Usually we just create a spreadsheet like this. Then how can you use this to create a map for visualizing what you are seeing? So there might be a need for data processing before you can go to the GIS. In this case, you might need to aggregate the data at the district level. Because the data here is just a line listing, a date, number of cases. But if you want to show this by location, then it has to be aggregated at the district level. That's one way of doing it. Remember, spatial data is data that is associated with the location. So in this case, our spatial data will have to be associated with a district. So aggregating at the district level is one way of achieving that. And this can be done in a spreadsheet application or a statistical program such as R, the data management part of aggregating. Then once this is done, typically you can export it to GIS and merge it with the spatial data that you have. So if I have Malawi districts as my spatial data, then I have to find a way of merging these Malawi districts with the spreadsheet data, so that I've got now a comprehensive spatial data that not only includes the district names, but also has got the number of cases attached to each district. Then I can go forth and visualize data. So this is just a simple example of a map that one can produce. So I've got cholera cases in 2022 and 2023. So what you can see here, just making sense out of the top level information, you can look at the, for example, distribution. Like in 2022, the northern part of the country, it seems to have a lot of cases. But if you go to 2023, the cases have gone down in the north. There's kind of a shift really from the north to the south when we move from 2022 to 2023. Okay, so that's one of the things that a GIS application will help you identify. Is there any shift in burden? So you can, by just looking at the figures and the visualization, you can have an idea of where the disease is shifting to. So that's in terms of cases. You can do a similar simple analysis with the deaths. Again, we do see in 2022 quite a few deaths in the north, especially along the lake. In 2023, it has kind of shifted. The burden has gone southwards. There are some districts that are having high cases in both years. There are some districts that have got high cases, high level of cases in 1 year, but the next level has gone down. To shed more light on the dynamics at a high level. But if you want to dig deeper to understand what is happening, then that might call for modeling, which we are going to talk about at another time. Yeah, then quickly going to an example of malaria. The goal here was to identify areas of elevated risk or hotspots. So if you just look at malaria, we know that it's but if we just look at prevalence or burden of malaria at let's say district level or national level, you might mask some of the differences that are taking place within the district. There might be areas within the district that have got high transmission, some with low. So how can you identify those hotspots? So in this case, we use data from past point reference surveys. So surveys that were just conducted in different locations like villages. So can we use this discrete set of points, point reference or point preferences to have an idea of a continuous surface for Malawi? Basically bring a prediction. So can we predict the prevalence of malaria even in locations where there was no survey conducted? So I'll give an example of Lilongwe district, just one of the districts in Malawi. I think you might, yeah. So that's Lilongwe district. On this inset map, that's the district within Malawi, and this is how the prevalence, when we extrapolated the prevalence from the point surveys to have an idea of the risk across the district, how it looks like. So from the legend here, just want to take your attention to the changes in the colors. Well, this is going to, or this tells us the differences in the prevalence levels. So darker colors are associated with low values, according to the legend here. These yellowish colors are areas of elevated risk or prevalence. So you can see that there is some location here with maybe the lowest, I would say the lowest risk is around here. But if you move around maybe westwards or northwest, you get a high, or the risk is increasing. If you go southwards again, there is an increase and so on. So the point here is that we don't have a uniform risk for this particular district. So GIS allows us to have that understanding, which is quite hard to get our hands on if we just look at numbers. You can't tell which corner of the country or which corner of the district has got elevated risk. But by visualizing in a GIS like this, it becomes clear as to where maybe more efforts are needed to change the course of the transmission. So that's just to mention here that linking this to the data types that I talked about earlier. So this kind of map then is generated using a raster data. So after you fit a model, the model outputs or the predictions, you can convert that into a raster data so that you are able to visualize something that is continuous. Okay? So this is using raster data that we have generated from the model to visualize the changing malaria risk to identify hotspots. So I think this is my last slide. Now, just to conclude, hopefully we have seen how GIS can help us to identify and visualize trends in disease outcomes. To achieve this, we really need to have access to spatial data to allow us to do the mapping. So we have to have the spatial data, merge it with disease data. We might also need to account for potential confounding. So we might need to include some pieces of information, let's say social demographic, population density, and so on, so that we have got a more comprehensive data set that we can use for risk mapping to provide variable tools for public health agencies. And just to quickly go back a bit, sorry, the map for Malawi, for Lilongwe, the districts, for the one that I just showed for malaria, in that case, we used both malaria cases and rainfall in the model to see how the malaria is changing with rainfall. But you can potentially add so many variables that are of interest as long as you think they are important explanatory variables. So I think this is my last slide. I'm going to hand back to Amy. Thank you very much.
Thanks so much, James. Thanks for walking us through that introduction to GIS and risk mapping and some of the key concepts. I will hand straight over to Samuel Omara, who is a GIS specialist at the GIS Centre for Health at WHO. Samuel, I know you're having some internet issues. Are you able to share your screen and speak?
Yeah, thanks, Amy. I will be sharing my screen shortly. The internet has stabilized, so should be good to go. If you can confirm that you're seeing my screen, that would be great.
Yes, we can.
All right, thanks. Yeah, so my name is Samuel Omara with the GIS Center for Health out of Geneva, HQ, but currently working out of Nairobi, supporting the Food Insecurity and Health Emergency IMST that has been set up in Nairobi. For this particular presentation, I will be talking in a couple of slides on the project that we are currently working on, which is related to climate and health in emergencies. The concept is around the virtual space that we are creating, and it's within the Climate and Health in Emergency project within the GIS Center for Health. Yeah, so in terms of presentation outline, I will just dive deep into some of the work activities that we've done related to flood risk vulnerability assessment of health facilities, and also looking, just touching briefly on the work around health service geographical accessibility disruption due to potential flooding in South Sudan and Somalia. I will also touch briefly on an extension of that work that looks at potential relocation of health services for partners in South Sudan, and then close with an overview of the CHEVS, which is the virtual space that I mentioned that we are currently working on. So we should be quite familiar with this. This is comes out of the PHSA that was published end of last year, which is not the first of its kind. There have, of course, been a number of documentations and publications that have been released related to El Nino related events by WHO from way back in time. But this is the latest one that we picked up on, and given that I am currently also with the Greater Horn of Africa Food Insecurity and Health IMST, we looked at it, and clearly there was a need to together with the GIS Center to come up with something that would guide partners and stakeholders within the emergency setting in the Greater Horn of Africa on how to best prepare and also to plan accordingly, and also potentially respond to the impending flooding that was expected to hit the Greater Horn of Africa. So out of that, the GIS Center was through other partners, we set up a team of a working group that involved the Global Health Cluster IMOs. We worked also with the WHO readiness team, and we involved WMO experts, and we are also currently working with a number of NGOs within this working group. And recently, our colleagues from POWER also joined this working group. And one of the first things we did was just to come up with a concept note around the scope of work that this working group would be involved in. And we currently have a weekly meeting that happens every Tuesday. So just to give a bit of context on the Greater Horn of Africa work, because it's also quite focused on some of the climate-related challenges that this region is facing. And so one of the key things that we've been producing at the Greater Horn of Africa is basically looking at the interconnectedness between the climate-related changes that are happening, but most importantly, looking at the impacts on the displacements and also the food insecurity situation, but most importantly, linking it to the disease outbreaks that we are monitoring in the region and also the trends of severe acute malnutrition. So this work has been going on for the last 1.5 years, and we keep informing our regional offices in the 7 countries in the Greater Horn of Africa with information linking these various thematic areas. One other work I will mention before going into the flood vulnerability work is again picking out from the first slide that I showed, showing the historical impact of El Nino in the region. We were able to overlay cases of cholera, and just again, not to draw any conclusions, but just to show and point out if there's some relationships between the two, the outbreaks that are happening in the region, and also the climate variations that are being experienced. Okay, so changing gears now to the scope of this work and the presentation. So we basically, together with the country office in South Sudan, they requested us to support the GIS Center to support them in carrying out a facility flood vulnerability assessment. And this was done because there was a warning, of course, that there will be tremendous amount of above average rainfall that was going to be received in South Sudan. And so they needed to again use whatever tools available to better plan and prepare for this. And that meant, again, looking at some key data sets, which my colleague in the previous presentation touched on. So we received data on health facility from the country office, about 1,900 of them. And out of that, we used about 77% of the data. And this really was because some of the data sets didn't have GPS coordinates, or they were just not fit for use. And one other layer that we used was basically population estimates from WellCome. So this also, in the subsequent slides, I will speak on that, how we integrated it into this assessment. And most importantly was data on flood-prone areas that for South Sudan, what we're able to extract from this link. Yeah, so from that particular work, we were able to quickly determine, maybe I start with this one. We're able quickly to overlay a number of the layers that I talked about at the beginning, the different layers, to really understand which are the health facilities, because the question at the time was from the country office was, we need to know which health facilities are prone to flooding based on their physical location. And so we overlaid this, and we looked at an area of all facilities. If we're talking of a catchment area of 1 kilometer, if a facility was falling within a flood vulnerable or flood prone area. And as you can see from this snapshot, the orange dots on the map show the facilities, the health facilities that are within less than 1 kilometer to a flood prone area. And then, the water bodies layer from OpenStreetMap, but most importantly, the flood-prone areas that we downloaded from the link that I showed. And out of that, we were quickly able to pick out that the South Sudan, 24% of the country is at risk of flooding or vulnerable to it, based on just the areas itself, the flood marshes and all that. And out of that, we picked out about 388 facilities where health facilities were located within less than 1 kilometer to a flood-prone area. And then we broke that down into, of course, the different categories of health facilities based on the data received from the country office, as you can see from this pie chart. But interestingly, if you look at the top right, we then went a bit deeper into looking at the counties, which again, to help the country officers prepare in terms of planning and weather prepositioning and all that. We had to go into the counties and look at which of the counties, which is in South Sudan, which are the most vulnerable in terms of having the highest number of health facilities located less than 1 kilometer. And as you can see there, that was then picked out and identified. And on the bottom right, we see now the use of the population estimates, because from the analysis that I'll talk about shortly, we were looking at the general access to health facilities within the country, and looking again straight line distance, not going into a lot of the details that would require a lot of other calculations. We just looked at the general catchment area of 5 kilometers, the number of people living or have access. When I say access, is physical access in terms of just the catchment of 5 kilometers. And we're able to then see out of those, if there was a situation where these facilities were to be flooded, how would that access be affected? And from there, you can see the drop in access, physical access across the different counties, as shown here. And you see some of them going from, for example, Rank, where there is a refugee response right now happening, that will drop to 50%. And others like Well North will drop from 69% when there is no flooding to 20% when these facilities are impacted. So going back to this, just zooming into, for example, this particular one. So we looked at the counties again, but this time we broke it down into the different categories of care, or health service points, hospital, PHCC, and primary healthcare centers and primary healthcare units. And you can see that, again, the gray areas shows access when in normal scenarios, and the orange one shows what would happen potentially if these facilities, health facilities, are inundated since they're located in flood-prone areas. So zooming into Upper Nile, for example, you'll see here how that would be impacted. You see there's a critical drop. For example, in hospitals, the number would drop from the current 21%, to about 7%. The similar scenario is noticed in the primary healthcare centers, where there's a massive drop from 34% in the current setting to about 5% across in case these facilities are affected. So we did similar Somalia, which actually was the first case study that we did, and that's also of course, these are the outputs again relating to the same thing that I was just mentioning about South Sudan. So moving into the next highlight of the presentation is basically the country office again came back, because now, given that we were able to identify these health facilities, they then needed to inform their partners on, well, since you've identified areas or facilities that are likely to be inundated, which are the potential areas that we as partners could potentially set up temporary relocations to offer services to people in the event. Of course, the different adaptation measures that are usually taken in the case of flooding, but one that we took was this particular section, which is the relocation. So we were able to, again, run an analysis looking at these sets of data. Again, very simplistic analysis, looking at the flood extent and looking at the digital elevation model, overlaying all that, and identifying basically sites or from the original flood-prone locations within a 10-kilometer radius, which are areas which are probably safe for partners to set up potentially health service centers or points to affected communities. So we plan to do this in more depth, but for now, the output was the generation of an interactive dashboard, which looks at basically each of the facilities that were identified as at risk of flooding, or the potential area that has been identified as having a facility that could be inundated, and then running again the analysis to pick out potential areas for relocation or setting up a temporary health service point. And this is the output that was shared. So to conclude on now the CHEVS, which is again our first attempt to kind of link, to kind of view, data related to climate, health risk, and other variables in one platform. We set out as a working group to develop this platform. And basically, out of this is to help in emergency situations, to be able for partners to look at this information and draw some kind of preparedness or planning work around it. And this is where the whole idea of the CHEVS came from. And the main objectives, as I was trying to mention, was to use open source data, which would also be available to everyone, to be able to explore basically whether it's research related information and also climate related information and health related information in health emergency settings. And the second objective, again, to provide access to knowledge, information, and health emergency readiness using the readiness operation training tool. Lastly, on objective 3 was to use this platform to inform preparedness through the production of GIS products, as you saw. So all those products would be included into this platform based on the countries that would have supported them on. So the target audience for this would be, of course, humanitarian partners working in health emergencies around the world, Ministry of Health, and the different UN agencies, including WHO. So the functionalities of the platform itself would have, or has now, which everything is built around the GIS component, which is different layers of data related to heat anomalies, rain, overlaid with the disease risk exposure layers, and also looking at where the emergencies are happening in terms of the health cluster presence around the world. We will also be overlaying data on the different hazards that would be available on this. And at the moment, we have different components of this would be the mind map area. And then we're also working with climate health team to be able to loop in their library of useful resources into this platform instead of generating this from scratch. We'll also have country statistics within this platform, and we'll link this to different training checklists for different emergencies around the world. So this is a screenshot, again, screen grab of what is already on the platform. So the different layers I was talking about. So this is built on ArcGIS Online platform, Esri. So the different layers I was mentioning will be persons of concern, which is where the IDPs, the IDP locations, which would host the most vulnerable people. We'll have layer on cholera, which is again working with the cholera IMST to integrate this within the platform. climate-related information, we're lucky to have colleagues from WMO within the working group, so they provide a lot of guidance on what are the most relevant at the global scale. But also, even though it's at global, most of the work that we do, like the vulnerability analysis, goes into local scale. One or two slides to go. So these are the different layers that we have integrated into the platform. And as I mentioned, the entire platform is built around the mapping and the GIS component that is already up and running. So in terms of timeline of the platform, we have, of course, set up the working group led by the WHO GIS Center for Health. We have integrated all the GIS and climate-related layers. What the stage we're at right now is the minimum viable product, which is left with a few things before it's deployed. We are now also working with the climate health team to integrate their database, just to pull in using API into the platform. We sent out a user survey, and hopefully we can also share within this group, such that we get feedback already from potential users in the field. So the current target is to have this launched mid-July. Again, it's an ongoing work that we will build on, having presentations like this to raise awareness of what is available. Last slide, unexpected results. Again, as I mentioned, it will be to strengthen readiness and preparedness in emergency, in public health emergency settings, especially in countries where we see a lot of emergencies happening, especially in Goa, Greater Horn of Africa, where we have countries going through multiple emergencies at the same time, but they don't have a place where they can go to look at climate-related information, disease-related information, all in one place, that we explore that information. Yeah, so I will stop here. Maybe the last slide is on some potential upcoming projects that we are working on as a working group. We're planning to look at some of this related to sea rise and coastal flooding. We also plan to work on something related to developing heat risk index, knowing that La Nina is already on the way, or in some countries already being felt. But again, this is focused on emergency, health emergency settings. And flood susceptibility analysis is something we are carrying forward. Ethiopia is next in line. They have reached out for us to support them develop a similar analysis to help their preparedness. Yeah, thanks, Emmy. Back to you.
Thanks so much, Samuel. That was really interesting and good to see the use of GIS practically around climate-related extreme events. Now, we've decided to change the agenda just slightly because we're very over time. We only have about 7 minutes left. So David O'Shea, whose name I am probably still butchering and butchered earlier, has kindly agreed to present in this afternoon's webinar instead, so that we have a little bit more time. As such, we have a little bit of time for discussion. We have about 6 minutes or so. So I will hand over to James Chirombo to moderate the discussion. We can probably take 2 or 3 questions, depending on how long we discuss the answers. So leaving it open, you can also ask Dave any questions as well, seeing as we didn't get to hear the presentation in this session. But again, it will be this afternoon and we will record it, so you'll be able to see it then. So I hand over to James to facilitate the discussion, and you can direct your questions to anyone who's presented, or just general questions on GIS or risk mapping for V&As. Thanks, James.
All right, thank you very much. So go straight into discussion. If you have a question, raise up your hand and I'm going to give you the floor. You can also type in the chat. There might be some questions already in the chat. Yeah, who wants to go first?
I don't see any hands yet. We do have a few questions in the chat, so we could have a look at some of those if no one wants to jump in. For example, David Brassfield has asked Samuel if the working group has considered adding conflict risk to the scope of the work.
Pardon, conflict risk?
Yes,
Yeah.
maybe David wants to jump in.
Sure, I could do that. Do you hear me?
Yeah, I can hear you.
Yeah, okay. So, of course, conflict has health consequences, just as natural disasters or climate disasters have. So the question is just, and there is a clear connection between climate and conflict risk. So the question is just whether that aspect, conflict, has been integrated into any of these analyses. Thank you.
Right, thank you.
Okay.
Sam, you want to comment on that?
Yeah, I think that's thanks for the question. Definitely that's something we will look into integrating because all these are these are factors that that in terms of layering we have not really looked at it because we're looking at some of the layers related to data on that would ideally would be exacerbated by climate change, and for sure that is also pointed out as a factor because climate change we've seen in countries where has led to whether it's raids in countries that have pastoralists. So this is something we will definitely consider integrating into our platform, into the platform. Thanks.
Right, thank you very much, Sam. There is a hand from Lisa. Lisa, over to you.
Hi there. Thank you very much. Simon, thank you so much for your presentation, which I found really fascinating. And my question was whether it's possible to look even further at the facilities that you included in that study and consider the potential resilience measures that there might already be in place for those facilities. Is that something that you think this kind of study could be extended to explore?
Yeah. That's I think that's a discussion for sure that we intend to explore again with the country office, because most times whatever guide them, of course, on some of this, but at the end of the day, in an emergency setting, like I'm just giving an example of South Sudan, right now they're in the preparedness stage, and this is not the first time it has flooded. So that there also need to be some long-term plans, as you mentioned, and that's worth giving as feedback to the country office on how best we could help them in integrating some of the resilience around, whether it's, I don't know, some practical things like whether it's weatherproofing, climate, flood proofing them in terms of how they're built and where they're built and so on. Yeah. But one other thing is on the heat, which we are planning to work on, because some of the practical examples could be as simple as making sure in areas where facilities are located, they are known to be in locations that are going to be in heat stress locations. Some of the practical reasons can definitely be communicated to them, and that's worth looking into too. Thanks.
Thank you.
Right, thank you very much. There is a comment from Ayanda. Says, thank you about the slide. I just want to find out if there is any SOP in place by WHO for floods and outbreaks. I'll take that. Sam?
Oh, okay. So
Yeah, go ahead, Sam.
I'm saying, can you repeat the question again?
Yeah, so there is a
SOPs.
question says, is there any SOP in place by WHO for floods and outbreaks?
So in terms of documentation, there is an entire site within the WHO website that looks at some of the guidance around climate change, and I believe colleagues on the call would also be able to clarify that. But I have definitely seen a lot of documentation around flooding, around heat, and all that. But within, in the context of health emergency settings, I haven't seen that yet, but there is definitely a lot of documentation and SOPs on this, on work related to climate in health.
Right, thank you. I think I'm going to give one last question to, I think I saw a hand from Sam. There's a Sam that raised a hand. So in the interest of time, I think that will be the last question.
Thank you so much for the presenters, all of you, for this presentation. I wished if there is a practical example how to analyze such data using ArcMap. Could you provide us with a link to see a practical example for this? Thank you so much. Over to you.
Right, thank you. I'm going to let Sam take this one.
Yeah, so we as from the GIS Center for Health, the number of what we call them knowledge series that happen every month, and within there the number of topics that are covered, of course using both Esri products and QGIS, and for sure, yeah, there's step-by-step guidance, and I'll also pop just a link in the chat if any of my colleagues on the call can do that, where you will find upcoming series that basically provide step-by-step guidance, actually live training or something like this on how to utilize GIS across different topics and areas. Thanks.
All right, thank you very much. We have run out of time. I'm going to hand back to Amy for last words and next steps. Over to you, Amy.
Thanks so much, James, and thank you very much to all our speakers. It's been a really interesting webinar. And of course, we've gone over time with the interesting discussion. I see there is quite a lot of questions still in the chat, so I hope we will be able to follow up on those. I will make a quick reminder, if I can share my screen, of the upcoming webinars. So you can scan the QR code if you can see my screen well, and you can see the next one, as I mentioned, is on climate resilient and environmentally sustainable healthcare facilities. And we do have another session of this webinar, as I mentioned, this afternoon. So we'll hear from cases from Nigeria and Cote d'Ivoire, and it will be recorded. So I just want to thank again the presenters, but also all of you for participating, for attending the webinar, engaging in all the rich discussion. Thank you very much, and we will see you at the next webinar. Have a great day.